YouTube land, what's going on? Bright and early, Monday madness. Long time no see. Dr. Dan back in the driver's seat. What's up, Little Rock? Big up. Good to see everyone ready on the Monday morning. Keeping it caffeinated. You guys know how it goes. Long weekend, guys. A lot of work. No rest for the weary. Setting up the Little Rock office. Finally putting the finishing touches on it. We're still taking face-to-face patients here in the Little Rock Clinic. Very exciting, big stuff. Finally put the finishing touches on the office. So now going to full-time schedule now. Boom. Here in the LR office, which is great. Sort of trying to kick things off and show the patient some love, y'all. We're cutting the clinic price. The thing, that's always exciting. Take less money. Fun from an ownership standpoint. But always cool, man. Pass it on to the patients. Gotta show some love, LR. You know, LR shown me some love, so I gotta show some love. $99, man. Cutting it from 125, cutting it to 99, just to show LR how much we're enjoying being here. Welcoming on new staff. Dr. Kyle now on staff. Y'all to meet him very soon when you come through. But yeah, big stuff happening here, which means I'm going to pretty much be based in the Northwest Arkansas office for now, which would be cool. Less driving. That's always awesome. But a whole bunch of stuff going on the MMJ front here in the office. Whole bunch of cool cases that I've seen. I'll make sure and put those on. Hopefully, if I can get those chunked through and edited, put those on YouTube so y'all can see the sort of things that we come through. The sort of things that we see here in the MMJ clinic. Big focus on mental health, which you guys know I like to talk about ad nauseum. Very interesting things happening a whole lot in the the service member population. Seen quite a few cases of PTSD combined with traumatic brain injury, which is what I'm starting to see, a growing population in terms of patient presentation, especially in the veteran population, but also you're finding this in other people who have played contact sports, that sort of thing, and also with coexisting PTSD. So a lot of stuff coming through, a lot of new patients. I'm finding people checking out marijuana therapy. The thing that I find very, very interesting, the most interesting to me, you'll find is the new adult patient, what I call basically a fence sitter before, who might have just maybe very distantly tried marijuana or might have just been completely averse to it for a sundry of reasons, and now coming to it as an alternative therapy because other things might not have worked, or for whatever reason, based on their personal value system, they just wanted to wait until they'd exhausted everything else before trying something like marijuana. And they're finding that it's a real welcoming relief for a lot of symptoms. Cure would probably be a bit of a stretch for a lot of things when it comes to marijuana therapy. You know what I mean? But I like to be upfront with that and really just highlight to people how good it is at its intended use and its therapeutic window of use in terms of being a catalyst for general wellness, better sleep, better control of anxiety, a little bit better control of pain, just so people can get that extra inch of functionality in their day and happiness in their day, so they can just get a little bit more fluidity in their movement and maybe just some calm to their thoughts, so they can just get that little bit of oomph in the day just to get them a little bit further. And that's really the main PowerPoint that I like to drive home with folks if they've ever been on the fence and they're unsure about, marijuana madness and, all of this other stuff that you might see flying around. This is your brain on drugs. No shame in keeping it hydrated, folks. I don't mind telling you. But yeah, definitely worth a talk about the new adult marijuana patient. Just some key things. You're not limited to just the combustible smoke aspect of using marijuana therapy, although I do believe that to be the most practiced means of taking in. There still are other options. So do bear that in mind. For people just looking to wade into the water, the edibles are an option. If you want to start low, go slow, just sort of going into the kiddie pool of things, there are the edibles which are an option. Some of those can be a kicker, but for the most part, I think due to their moderate dosage, usually 10 milligrams per dose, and their extended release due to just going through the gut and liver metabolism before they're absorbed into the bloodstream, takes a lot longer versus the straight inhalational route, where it hits that rich capillary bed at the base of the lungs, where it's sitting right by the diaphragm, which is just very enriched with a vast vascular bed. So fast uptake when it goes through the lungs, and it just goes through that route. The cannabinoids being very lipophilic, meaning they move through lipoid fat substances very well, the cell membranes very well. So reason why the inhale route is so common, because it's just fast and dependable. With that being said, I'm a big proponent of the dry herb vaporizer, which can sort of circumvent the products of pyrolysis. Pyro meaning fire. When you combust something, you barbecue it up. You know what I mean? So you can do that with a dry herb vaporizer, and also you can still get a full spectrum taste on the inhalation, because you're using the whole bud and not a pressed oil or some sort of processed concentrate that can strip a lot of the terpenes and secondary cannabinoids from the bud product, which will have the full spectrum there, all the terpenes, excuse me, flavonoids, accessory cannabinoids, CBD, CBG, what have you. So those are just things to consider through routes of administration, because you're not going to get the same thing when you use a different product. And that's very important to making an informed decision. Also, things to consider when you take an edible product, there is the issue of the glycemic index. Depending on the sort of presentation that you have, a lot of peripheral neuropathy patients, that's secondary to type 2 diabetes. That's not a patient that I'd necessarily want to take a high glycemic index product like an edible. So there are very real world considerations to look at, economic considerations to look at. If you wanted to bypass the smoking option, that's always a thing I like to look deeply into because it's pertinent. Economics of things are also pertinent. So I suggest to people a whole lot, and maybe my YouTube channel isn't the most useful for this one, but to make your own cannabis oil, it ends up being a very simple process and economic, because you can adjust the strength of a self-administered product that you can make very simply and easily at home. And basically it goes something to the tune of, get the regular bud that you'd get from the dispensary, you grind it up, you put it into some sort of apparatus, either a slow cooker or a double boiler, something of that nature. You put a high boiling point oil, something to the effect of avocado oil, which has a high boiling point. I don't know the numbers right off the top of my head. Something like coconut oil, which is more likely to be more of a solid, semi-solid at room temperature, which would be able to handle an extended heat sort of burn at a low temperature, which is what I think they look for when you're making cannabis oil. So you put the ground product, grinded, not correct English. Still getting the coffee in. Put the ground bud product in at some ratio. Y'all will have to look it up on YouTube. I'm not the go-to guy for that. But you put the bud plus the oil, at some ratio and put it low heat and watch the temperature carefully. Key pro tip is to get the thermometer and watch at a good temperature, and keep it at a low heat. At that point, you extract it through some sort of sieve type measure, maybe coffee filter, something along that sort. And then at that point, all of the cannabinoids and everything good that you'll want as medicine will be there in the lipid phase, the oil. Okay. So that's what you'll be left with. And you can use it in a dropper or put on top of food and use as an edible, thereby having to buy the oil there in the dispensary like that. You can just make it there at home, far more economical and usable, and you'll just have there very quickly accessible. Pro tip as well, you do want to store these things in either an amber bottle or a dark place, because the cannabinoids are degraded by light. You always want to keep your product sort of away from a whole lot of light, because that'll chew up a lot of the terpenes. So you always want to keep your product in a dry place, a fairly ambient temperature place, that sort of thing. Not too hot, not too cold. So just something to remember. So yeah, the oil, just a good pro tip, something very accessible while I yap on here Monday morning. Folks, good to have y'all with me. Just wanted to welcome you guys again, the Little Rock office. When y'all get a chance, check it out. If you're new to the whole realm of cannabis, welcome. I'm always happy to go drone on and on about the wonders of what you can do just with alternative therapies in general. Cannabis is really not the only thing out there, but very much a good thing if you're looking to wade in that direction of taking your health sort of into your own hands and looking to wean your way towards a dependence of constantly being on medications that might come in pill form, and just how to go in a different direction. All right. So guys, keep yourself awake and ready and hydrated. Enjoy this Monday morning. I look forward to meeting a whole lot of you guys. Have a great Monday. Bye.